Hello, and welcome to the Ovarian Club, a glimpse into conversations between two besties across countries, South Africa and France, tackling the trendiest women's wellness topics through a scientific lens. Join me, Dr. Tarryn, and health expert Emma as we explore delicate subjects related to the women's health space. We started this podcast to share our conversations to help navigate the complex women's wellness world. We hope you enjoy the podcast and take away as much from it as we've enjoyed making it. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. So, my follicle friends, let's begin. How's it, Ta?
Hey, Em, how are you?
I'm good. Here on a nice, sunny, finally, Saturday morning. Yesterday, the felt temperature was -8 degrees. So I was not vaguely ready for that. How are you doing, Ta?
Yeah, good. The weather is absolutely beautiful. It's a Saturday morning. I am so excited to, no offense, but get this episode done so that I can hit the beach with loads of sunscreen, of course.
Lucky
and otherwise I'm so excited to be here and to chat GLP-1s and Ozempic. I mean, who would have thought this tiny gut hormone that is literally making a massive medical revolution? It's really exciting to dig into this one today.
Yeah, me too. I feel like, Ozempic, certainly not, and GLP-1s, it's not necessarily a new thing. I mean, it's been like the buzzword for over a year now. But I do still feel like there's so much misinformation around it. And I do feel it's cropping up in the news again. A lot of kind of things around questioning the safety, long-term impact. So yeah, just really looking forward to digging into it. And understanding, what is it, the original use, who should be using it, who shouldn't also be using it, the benefits, the risks, etc. But before we dig in, just a couple of disclaimers. This podcast does not represent any of the opinions of the company I work for, and the opinions shared on this podcast are solely mine and Dr. Tarryn's.
Yes, and just to continue with those disclaimers, although I am a qualified medical doctor and do frequently administer GLP-1s, this podcast does not serve to offer any personal medical advice, so always seek the advice of a healthcare professional with regard to any condition or treatment you may be seeking.
So with those disclaimers out of the way, Ta, let's dig in. Let's start off. What are GLP-1s? I feel like a lot of people use them interchangeably. Like they just say Ozempic and they call all GLP-1s Ozempic, but there are many different types of GLP-1s. Ozempic is just one type of GLP-1. So can you break that down for us and just also explain what is the drug? What are we looking at? And how does Ozempic fit into this?
Perfect. So GLP-1s are actually naturally occurring gut peptides, right? They're in our bodies. It's not a medicine. A GLP-1 is a glucagon-like peptide. It's a hormone that our guts typically secretes in response to food intake. Okay. So this is a naturally occurring process. It's happening with you and I without the injections every day. Our guts are producing GLP-1s. Okay. Ozempic, as well as Wegovy or Mounjaro, these are GLP-1 agonists, okay? So it's a pharmaceutical compound to mimic our naturally occurring gut hormones that are GLP-1s to exert stronger effects on the body, to basically decrease hunger cues, delay gastric emptying. We will talk about all of it later down the line, exactly how these drugs work, because essentially it's just mimicking what a GLP-1 naturally occurring compound is.
And there are different types of GLP-1 drugs, right? So you have I can't pronounce that.
Semaglutide?
Semaglutides, that's an Ozempic, but you get many different other types. Can you just kind of break down what are the different types?
No, good question. So there's actually quite a few. In fact, as we're speaking, more and more are evolving, but the main categories are semaglutide, which is otherwise known as Ozempic or Wegovy. We've got liraglutide, which is Saxenda, which is kind of going out of use, in my opinion, and Victoza as well, licensed just for weight loss. You've got dulaglutide, which is Trulicity. I'm also seeing less commonly these days. And then the big one, the one turning heads, is Mounjaro, which is tirzepatide. Okay, and what's really cool about Mounjaro is that it has dual GLP-1 and GIP effects. So basically, it acts on two receptors. It doesn't act on one; it acts on two. And it's been shown in trials to exert much more potent effects on the body. And they say that weight loss is actually more marked
Yeah, would love to hear more and dig into that in a little bit. But you also tapped onto something. You mentioned something with regards to the usage of this, and that Saxenda, for example, is solely for weight loss. That brings on to an interesting question: the original use. So these drugs are not new, right? These drugs have been around for quite a long time. They've been used before for diabetes, and as actually has been a diabetes drug. And I think there was a massive, massive scandal around the fact that a lot of diabetes patients who needed this for actually being able to survive were not able to get medication because this was being used for weight loss purposes. So can we speak more about that, like the actual original use of the drug, and how did this kind of morph into a weight loss drug and get used off license initially and then get included in the label weight loss?
Well, I mean, in order to answer that, I think it's quite important to elaborate how these drugs work on the body and how that would indirectly improve diabetic sugar control, right? I'm going to try and make this not so sciencey. I'm going to make it as simple as possible, but bring me back if you're not catching anything. So basically, the GLP-1s act on multiple sites in the body. So basically, it acts on the pancreas to stimulate insulin secretion, which then brings down glucose levels in the blood. It acts on the liver to lower glucagon, and then that indirectly also reduces sugar or glucose output. It acts on the stomach, which delays gastric emptying, makes you feel fuller for longer. It then also acts on the brain, and the amygdala in the brain, and basically this shuts off all the hunger cues and switches off all the food cravings, essentially, that food noise like we like to talk about. And so basically, given that it lowers the glucose levels in the blood, it was licensed originally for type 2 diabetes. Not all of them. Some of them, I think Saxenda, I think it was, liraglutide was always only licensed for weight loss specifically. But the majority of them were type 2 diabetes or insulin resistance, like pre-diabetes. And then it was used off-label for weight loss because the studies were just showing remarkable weight loss effects.
What is actually fact and what is hype? So I think there's so much at the moment where this is being like cute as this kind of miracle drug. What are the studies suggesting? How much is this actually like this is an absolute game changer? But,
Okay, so definitely fact is that it has been shown to cause significant weight loss. So if used properly and with a good lifestyle program, it can cause significant weight loss. And that is definitely a fact, okay? It's also a fact that we're seeing benefits on our cardiovascular health, right? Trials are already showing the reduced risk of heart attack, stroke, and death in high-risk patients. So the benefits go beyond simply weight loss and beating insulin resistance. I think where it becomes a bit of a myth is that GLP-1s is a one-size-fits-all and it's like a magic cure-all. So in other words, you just take the GLP-1s and you don't have to like put in the work. You don't have to exercise. You don't have to do weight resistance training or eat a good diet. Just take the GLP-1 and you'll be fine. I think that's a myth. There's a lot of hype now around microdosing it, and there's been absolutely no studies surrounding microdosing. So, I mean, I can't really comment on that. But they're basically using like lower doses for this anti-inflammatory benefit. Maybe it works, maybe it won't work. Like soon we'll see. I certainly cannot advocate for it on this platform, but I do think this whole like anti-inflammatory thing could be a bit of a hype for now. Like, I say it's a hype because we don't know if that's due to the weight loss itself. So you're losing weight, and then if you're losing all that excess adipose tissue, it's automatically like less inflammatory on the body, right? So then you in a more anti-inflammatory state.
She's spoken a lot about the benefits, and I mean, they seem pretty outstanding. And I think we know the impact on our society in terms of health when it comes to being overweight. We've spoken about it quite a lot in our previous episodes, also from a hormonal standpoint, how that can impact hormone levels, how important that is to also regulate your weight to be to make sure that that is something that you keep under control. But what are the risks? What are we looking at, and what is actually valid in terms of the risks, and where do kind of the benefits outweigh the cons? So being, for example, overweight, and what does that actually mean in terms of overweight? What actually classifies you as being kind of in that thing where the benefits way outweigh the risks?
Okay, so we'll let to tackle that question. Let's answer who should be using them, right? So if you are obese, which is classified as a BMI, body mass index above 30, you're classified as obese. or if you have a BMI over 27 with a comorbidity, so with high blood pressure or insulin resistance or dyslipidemia, cholesterol problems, then you'd also meet the criteria. I actually completely disagree with this criteria because you could have a high BMI but be muscle, and muscle's good. Like muscle's like really good. So um, I think it's a very poor cutoff. And I definitely like to assess my patients individually. Sure, you can take one's BMI, but it's way better to do a body scan where you can actually look at the composition in the body to see what is muscle, what is fat, because we're really concerned about fat. And we're not just concerned about any fat. We're actually concerned about visceral fat, the bad fat that lines the organs internally inside our body, which you can't typically see. I mean, sometimes you can get a sense if you see an overweight person with a boop like a belly, you could probably infer that they have increased visceral fat. But to be absolutely exact, you should do it with a scanner, like those in-body scanners. But anyways, so I would say if you could just avoid taking an exogenous substance, also from a cost perspective, these drugs are so expensive at the moment. I'd say it's better if you could just try tackle all these things with lifestyle, eating well, consulting a dietitian, doing weight resistance training or any training for that matter, something that you're good at consistently doing, exercise wise, that would be the best. I mean, but then again, if you do meet the criteria and you failed the lifestyle interventions and you just need that extra support, it's probably worth an attempt. In consultation with a medical professional.
I think there is a lot in our society today around diet culture. And I think that this is becoming a very big part of that. Not that diet culture is new, but I think that this is a new part of that. Yeah. And I think that a lot of people are turning to this as a kind of quick fix to lose those pounds. And my understanding is that if you are, not obese or you're not overweight, but you are just looking to kind of have this to kind of trim down, what is the literature saying about this? What are doctors suggesting? Because my understanding is that it wouldn't be necessarily recommended for these patients. Maybe it would be more looking at psychological support or, as you say, lifestyle interventions as a first port of call.
Yeah, I definitely would say that it's not recommended to just lose a couple of kilos, because the likelihood of gaining back the weight is very, very high. Okay, so if you're just lose a couple of kilos without a contingency plan in place, then it's not going to be a good idea, because you're going to stop the drug and you're going to gain the weight back. Almost like up to 2/3 of the weight can be gained back, like in a very short span of time. That's what the studies are showing.
So you didn't already mention the boomerang weight gain as kind of a risk, and that's something that people should be aware of, that if it's not coupled with lifestyle interventions, that there could be this kind of boomerang effect and that you could put on the weight again. I know we kind of parked it, but let's get into the side effects. I know you mentioned that most of them are pretty mild in terms of the side effects, but that there are some more significant risks, although very, very, very rare.
So with the risks, I always like to screen my patients for contraindications, right? So firstly, do they meet the criteria? Like, do they have significant weight to lose? Have they failed lifestyle interventions? All of that. Do they not have an eating disorder? I mean, that's super important. Do they have other comorbidities like thyroid problems or diabetes, like other comorbidities that require addressing, right? They might also benefit from a GLP-1, sure, but you also need to address the other medical causes. But then I'd also screen that they don't have any contraindications, and that would be like history of thyroid cancer in the family. They don't have significant gastric problems like previous pancreatitis, gallbladder, gallstones. They're not complete contraindications, but we'll soon see that some of the side effects can be pancreatitis and gallbladder issues, gastroparesis, which is basically like when the gut just freezes and doesn't move. So if you are prone to like gut issues, I would be a little bit skeptical, or at least really watch my patients with the doses. Start very, very low in those patients and monitor more closely. So yeah, those would be the main contraindications. And yeah, I think if you meet the criteria and don't have the contraindications, and you're addressing the other medical comorbidities and lifestyle factors, the risk is fairly low. And I think it's, especially if it's done with the guidance of a doctor who can manage the treatment plan with you.
And how much do we know actually about long-term impact of the drugs? Because, I mean, there haven't been any long-term studies other than obviously
Yeah.
for diabetes patients. So I know that that's a big question that always comes up with
Yeah.
pharmaceutical products and drugs and everything. But I think that this is a very important piece that I often hear is taken into consideration when people are looking into whether or not to use a GLP-1.
So these drugs have been around for about 15 years. I mean, with the newer ones evolving like in more recent years. But long-term wise, I mean, what we do know is that the weight can rebound. I mean, that's one thing that we're already seeing. But we're also seeing significant impacts on health in the patients that truly need it, right? You can control the sugar so well that they become less insulin dependent, which is like very, very incredible to see. We also trials are already showing the reduced risk of heart attack, stroke, and death in high-risk patients, which is amazing. I mean, these benefits are extending beyond weight loss, right?
And sorry, and high-risk patients would be classified as someone in terms of weight loss or someone in terms of diabetes?
High-risk patients are patients with cardiovascular risk factors. They like maybe have dyslipidemia, they've got poorly controlled blood pressure, they might have poorly controlled diabetes as well. Those would be your high-risk patients. It's the patients that are high risk that really see the greatest benefit, for sure.
I think that's really helpful because I think that the impact of being overweight, I mean, that can lead to diabetes if you don't already have diabetes, and that's not the cause of being overweight. As we touched on earlier, the impact on hormones, the impact on your bones, your joints, everything like that. I mean, it's so significant on your heart, on your organs, everything. So if you are very overweight, I would imagine that losing weight and using a GLP-1 would outweigh, as you say, the risks associated with it.
Yeah. I mean, just to touch on the other risks, so common side effects would be nausea, vomiting, diarrhea, or constipation. Those are all commonly reported side effects, which I would argue aren't that risky. I mean, sure, you could become like super dehydrated and take yourself to hospital for an IV just to get hydrated again. I mean, it's not ideal to have diarrhea for a week or two, but it usually settles, okay? Sometimes you'll notice it when you're going up with the doses as well in dose increments, but generally those are minimal side effects and they settle. The more serious ones would be pancreatitis, the gallstones, the gastroparesis, and then there have been case reports of eye problems, so optic neuropathies, like basically vision loss, super rare. This is an adverse effect that has been well documented. I mean, patients must go in knowing that, and yeah, those are the big risks.
And Ozempic face, can we just touch on that? I mean,
Yeah.
from my understanding, that's pretty much Ozempic face is right when your eyes look sunken, your face looks a bit kind of sunken in, you have extra skin around your neck or your chin area and everything. But my understanding that is just from rapid weight loss, so it's not related to GLP-1s necessary. But can you expand on Ozempic face? Because I feel like that's the huge topic when we are talking about GLP-1s.
It is, and we see it a lot. I see it a lot because I also work in aesthetics. Full disclaimer. So a lot of patients come with bothersome symptoms. They're losing facial fullness. There's more sagging. The subcutaneous fat layers rapidly drop. As you drop the weight so quickly. So they come in needing fillers or like volume amplifiers, basically to kind of resurrect the face. But yes, I think if patients are doing this properly, so they're not losing weight too quickly, they're eating lots of protein, they're exercising. I mean, this is not just, with reference to the face, but also the whole body, right? Because it's not good for you to just drop muscle. You actually want to preserve your muscle. It's better. I always say it's more ideal to lose a little bit less weight on the scale per week. Say 0.5 kilos to 1 kilo a week is acceptable, because then you're likely losing more fat than you're losing muscle. If you're losing like 2 kilos a week, that's quite rapid, and you're likely losing a lot of muscle with that. Muscle, remember, also increases your metabolic rate and increases your health, your vitality. So you want your muscle in check. You do not want to lose muscle. With the Ozempic face, it is a massive, it's a big problem that we're seeing. And I always screen patients for like eating disorders as well, because it could signify that when they are eating, they're eating poor quality foods or they're just not eating at all. And that's not good. You should not be taking these drugs and not eating at all. obviously your caloric intake will naturally decrease because you won't feel the hunger cues and you'll feel full for longer and for all the effects that we mentioned. But you must make sure that you're making a conscious effort to eat and eat good quality, high protein foods to mitigate the muscle loss.
So that's quite an interesting point. So you said 0.5 to kind of 1 kilo per week as opposed to two or more kilos. What is kind of the standard weight loss with GLP-1s? I know it also depends on which GLP-1 you're using and kind of how long are people on GLP-1s for? Like, does it really depend on how much weight you need to lose to get a healthy BMI, or how does that actually work in terms of the duration and how much weight one can expect, obviously ideally coupled with lifestyle interventions at the same time?
Yeah. So the bigger you are, the more quickly you'll lose the weight. That's something that I've definitely found from clinical practice. People that have the weight to lose drop the weight faster. Having said that, it's not good. It's actually it's unhealthy to lose weight so rapidly because it just increases the risk of rebound. As quickly as you lose the weight is as quickly as you gain the weight. So I always say to the patients, if you're losing more than 2 kilos a week, that's too much. Actually, I would say go slow. Try, eat well while you taking the drugs. Generally, they're administered on a weekly basis as well. Just FYI. So before you re-inject again, just check in. Rather do it slower because then the risk of rebound is lower. With regard to maintenance, this might well be a drug that requires ongoing maintenance due to this risk of rebound, even if you're losing the weight slowly. Or at the very least, my advice is, as opposed to just going off the drug, taper down the dose, of course, in consultation with a medical professional, but taper down the dose and then do this all with a good lifestyle program in check so that when you are off the drug and all of a sudden your satiety cues come back, you want to eat again, you're ravenous actually, you have like a good solid foundation to land on upon finishing your course of Ozempic. But a lot of patients are on it continually at just like a very low dose just to block out that food noise because the risk of gaining weight is high.
So that you mentioned that your appetite returns and you're actually like ravenous. Are you more hungry as a result than you were maybe before? Like, has your appetite actually increased, or has it just in comparison to the fact that you didn't have any appetite before, that it comparatively seems to be much more strong or you're much more ravenous? And another question would be around the kind of sustained weight and just making sure that there isn't this boomerang. Like, that for me is where I think that the psychological support is so important, because I think that there is this kind of need to also address maybe some of the underlying psychological factors that may be contributing to overeating or finding comfort in food.
So this question was, when you go off these GLP-1s, are your appetite cues actually higher than baseline? And I would argue probably yes, because when you are on these GLP-1s, especially for a long period of time, it resets your metabolic rates. And basically, it signals all these hormonal cascades in the body so that when you go off them, the hormones suddenly don't know what to do with themselves. And between your ghrelin, which is your hunger hormone, and leptin, your satiety hormone, they're all confused. The metabolic rate is reset. And at the very least, it returns back to normal, how it previously would have been. But I would probably argue that it's actually even more exaggerated. So when you go off these GLP-1, suddenly, yes, you at least feel a lot more ravenous than how you were before. And then just to touch on your emotional eating group, I mean, this is a very important group. Basically, patients who have binge eating disorders, the GLP-1s suppress appetite, but they do not address the underlying neuropsychology, and they do not turn off the dopamine-seeking behavior. So what I'm trying to say is that if you have these disorders and you're just taking GLP-1s to think that you're blocking out the food noise, well, because you're not addressing the mental problem, even though you feel full, even though you're not hungry, you still eat over your cues because you have a psychological problem. We often see GLP-1 non-responders is because they have these underlying mental health issues, and then not just that, but then also like maybe other medical problems that are not being addressed because you're going on the black market. You're just going straight to like go to your hairdresser, go to a nail salon and buy GLP-1s there illegally, might I add, in South Africa at least. And it's not being overseen by a doctor. So that's also something to take into consideration.
So what is this black market? I mean, the fact that you can go to your hairdresser and get Ozempic, I mean, How do they get hold of Ozempic?
From distributors, and it's a huge problem. Basically, people can access these drugs fairly easily without medical insight, and it's not just in South Africa; it's all over the world. And the question of like whether we're over medicalizing this, do we even need medical input? Everyone might as well just bypass the doctor and just get their hands on it and do it themselves. But you have to have very good insight to know how do you work these injections, not overdose accidentally by mistake, because I've heard of lots of cases of people overdosing.
What happens if you overdose?
Well, I mean, you could get quite sick. Like, I mean, the cases I've heard of, like a girl was just in her room and she'd overdosed Ozempic and was vomiting nonstop for 3 days, like just couldn't leave her room, like super dehydrated, which is just not ideal. But yeah, this whole black market thing is, it's pretty dangerous. It's happening. It's all around us. And I would just say to all patients, tread with caution. At the very least, just check in once with a healthcare professional. Make the doctor do like a full list of bloods. I mean, I did a reel on it of all the bloods that I would order, just to make sure that all your other comorbidities are in check. Have like a good baseline of your weight. Go for the in-body scan so you know what is visceral, what visceral fat versus muscle. Like what are you wanting to lose? What's your initial baseline? And so it's always good to have that initial check-in. Is my opinion.
Well, I imagine that you need a prescription to get hold of this, right? So, I mean,
yeah.
I know not on the black market, but how are they doing any kind of quality? I mean, that's terrifying. What people probably also don't realize is that there's absolutely no quality control, right? So there could be kind of counterfeits. People don't realize how much counterfeit medications there are and how dangerous that is, because there's no quality control. There's no, they could be laced with other things. I mean, that's what's happening. I mean, it's a completely separate topic, but that's what's happening a lot with this fentanyl crisis, especially in the US, is that people are thinking they're taking a Xanax and it's actually laced with fentanyl and people are dying. So, I mean, beyond just the fact that you don't know what you're dosing, beyond the fact that you don't know what you're necessarily, you haven't had the proper screening.
Yeah.
You have absolutely no, it's very dangerous. You don't know what product you're getting. There's no quality control. So that makes me really upset. Sorry.
Yeah, no, of course, as it makes me upset too. But yeah, I mean, other than that, it is really just like a wonder drug. And I really believe that. Like I've actually seen with a lot of my PCOS patients, I mean, because we are a women's health podcast, I'm just going to quickly bring it in, with patients with PCOS and insulin resistance specifically. We're seeing like periods come back, like in patients now with PCOS. We're seeing their periods come back. It's improving their fertility. But just to note, very importantly, is another contraindication is pregnancy. So you can't use this in pregnancy. So obviously, like, it's great to get your periods back, be fertile again. But at the same time, once you do fall pregnant, you have to go off it, of course. But it's a very exciting space, especially for women's health. Yeah.
Well, that's actually a big trending topic at the moment, is the fact that they're called Ozempic babies. So it actually seems to be increasing fertility, and a lot of people are getting pregnant after taking GLP-1s. So it does seem to boost. Is that just because it regulates the hormone levels if you are overweight beyond just PCOS, or is it just with anyone that it could maybe boost fertility?
No, I would say it's just for that anti-inflammatory, that off-label like benefit, but it's anti-inflammatory due to the weight loss. So it basically regulates all the hormones again. Your body is more in sync. Everything, the brain's talking to the ovary again, all due to the anti-inflammatory effects. But yes, I mean, it's not only restricted to PCOS that we're seeing benefits here. I mean, any obese patient with dysregulation in the body, gut problems, all of those. The GLP-1s are really working its magic here and actually helping rectify many things.
And looking ahead, what should we expect in this space? Because I think it's a fast developing. I mean, there's a lot of new products coming to market. You mentioned Mounjaro. There's a lot of, a lot of talk, a lot of studies, a lot of, microdosing. There's so much going on in this space. What should we expect looking ahead?
Yeah. So there's lots. Okay, firstly, the GLP-1s, we're already seeing the dual agonists, the Mounjaro, that's already on the market. But soon there's going to be one peptide that actually targets 3 different receptors, even more potent. There are currently trials undergoing at the very moment that we're recording this, and it's thought to be even more potent. So I'm very excited to see what emerges in that space. So there's the next generation molecules, but then there's also the fact that they're actually developing oral formulations. So you don't have to inject yourself. You can actually take these oral formulations, which is very exciting. I believe it's going to be way more accessible. And then we're also seeing, I alluded to it earlier, but the neuroprotective effects, like does it prevent or help Parkinson's and Alzheimer's? This is an area of ongoing research, but I'm really excited to see what emerges in the space. So yeah, the future is looking very, very bright, I would say. And GLP-1s are, I believe they're here to stay. I generally, my belief is that if it's prescribed by a medical doctor who's overseeing it, I think there's the benefits definitely outweigh the risks, provided you meet the criteria and you don't have the contraindication. I think there's a lot of benefit there. And yeah, I'm just excited to see how it constantly evolves. And I'm praying that the price goes down, because that's like the big barrier at the moment is the price. So I'm just hoping that it becomes more accessible.
I agree with you, Ty. I think it's an exciting space. And I think that given the impact of obesity on our society, obviously has huge consequences on people's lives. But I think that there's a huge amount of really exciting things in this space. And I think a lot more to come. So thank you for tuning in. And please don't forget to subscribe and also leave us your thoughts, whichever streaming platform you're listening to. But also don't forget to follow us at the Ovarian Club on Instagram.
Yes, thank you so much, Em. This was such an awesome conversation. And I invite you all to send us questions. We're more than happy to address them on our other socials. And yeah, that's all for today, folks. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. We'll see you soon, follicle friends.